ANI is the Arkansas Neuroscience Institute, and when we started it, the plan was really to establish a center which will become like a lighthouse for the ships, and this is a lighthouse for neurosurgery. Whether treatment or learning or research that is related to the brain and diseases of the brain and the neurosurgical treatment of these diseases, that we will be the place to come to. We've been recognized for a lot of things that we do, but there is a lot more to be done. Neurosurgery is a field which is very unknown. We would like to become an oasis for all these thinkers and people around the world who deal with neurosurgical problems to come visit with us and to be able to learn from us, at the same time to contribute to our learning. Our initial impact and goal is to take care of the patients in our community. But at the same time, our reach is beyond that. It's more national and international. This is why we have opened our program to receive patients from around the nation, and we do a good number of our patients, because of the unique aspect of what we do here and the fact that there are a lot of what's considered inoperable tumors that we are able to manage and give these patients some help beyond what's available in other places. This usually includes tumors which involve regions in the skull base and difficult tumors within the brain itself, as well as very difficult aneurysms.
We have so many international fellows that come and want to watch him operate, and they have the opportunity of coming to the lab, and we do courses where Dr. Krish will demonstrate, and then they're allowed time to follow what he has done and replicate what he's done. At the same time, he and Dr. Abood and whoever our other visiting faculty are following them, watching them, guiding them, educating them on what they're doing wrong, explaining what they can do to improve on their skills. It's just a wonderful opportunity. We have a great lab, wonderful setup, and Dr. Krish spends a lot of time teaching, explaining and educating. Not just the fellows, but also the staff on the hospital, myself, and all of our other nurses and faculty.
This is very rewarding because you cannot treat every patient around, and you have to treat those who are close to you and at the same time enhance the treatment for those who are far. A lot of the cases we do are very long, exhausting, and we don't always win. Sometimes we lose, but you have to keep going. And through education and research, this is what keeps you with the promise that hopefully you'll learn something new and do something better. There's no doubt we are able to more safely operate on patients, get them home faster, and in a much more functional state, but there's a lot of homework to be done. With St. Vincent and the leadership, they have already opened the door and for the possibility of having one of their hospitals become our institute. And this is the St. Vincent Hospital in North Little Rock. And the plan is to also build next to it a research and education center. And we're hoping to achieve this through grants, donations, and with the support of the community. And if we have this put together, this will allow us to establish a setup where everyone in that hospital is thinking neurosurgery problems, brain problems, spinal cord problems, spine problems. So this will be the ideal setup for patient care. And this will be the place where anyone in the state can call, refer, and transport patients with a helicopter pad where you can immediately bring patients and start the treatments so that you can achieve great outcomes for our patients. And I know this is a setup which, once it is established, it will really elevate the level of care to our patients to a standard that can become the model that everybody in the world wants to come and see. And that's what we're hoping to achieve.